Well, there's no such thing as a cookie-cut approach when it comes to hearing aids, and with Arizona Hearing Specialists, you get a customized treatment plan with your lifestyle in mind.
Yes, and the owner of Arizona Hearing Specialists, Greg Swingle, is joining us now to explain. Welcome back, Doctor. It's good to have you here.
Thank you. It's good to be back.
So I don't think we can talk about the future of hearing aids without reflecting on the past and how we have advanced so much. So let's talk about how hearing aids have progressed over the last few years.
Certainly, yeah. Hearing aids have definitely come a long way. About 20 years ago, they were analog devices. I brought a couple here to kind of show. A lot of times, this device here is kind of an example of what a lot of times people think of when they think of hearing aids.
The beige one there on the table.
Yeah, this guy right here. It's kind of the typical analog device that's very large, and it's got a lot of bulk in the ear, and a lot of times people did not necessarily like them very much.
And they're easy to see.
Yeah, very visible, and so people would basically be resistant to wearing them. They helped, but they didn't help enough to where they were willing to put them in their ears. 20 years ago is when the first digital hearing aids started to come out, which 20 years ago, it was really just a computer chip, and we really had the same limitations with the hearing aids. We just had a little computer chip in there now, and we programmed them through a computer instead of the little adjustments on the instrument itself. So that digital computer chip inside there really opened up a door, though, and so over the past 20 years, hearing aids have come a very long way, and we're able to do a lot with them now that we couldn't even imagine 20 years ago. So it's a fantastic technology these days. One of the things that we've started to see happen more and more, about 10 or 15 years ago, we started seeing these other devices, such as this one here that you see there. That was a device that would basically connect to a phone or a Bluetooth device. So you essentially are able to connect or pair the iPhone or whatever kind of a smartphone or iPod to that accessory, and then the sound goes directly into your ears. So it was a good way to give you a cleaner signal. So instead of the sound traveling to get to you or coming out of that poor cell phone speaker.
Of course.
And basically it gives you a much cleaner signal. So
like a heightened Bluetooth in a way.
Exactly, yeah. And it's nice because it goes to both ears. So essentially those accessories really started to open up a new door. And nowadays we're seeing more and more where hearing aids such as the smaller devices that you see here, and I can just kind of show you how very invisible they are. Basically, you don't even see them these days. And the earpieces are not necessarily bulky. They go into the ear still, but we can do a lot with much smaller types of components. And so those hearing aids, even though they're so much smaller than they used to be, they can be just as powerful as, if not more powerful than the older ones, and they can start to connect wirelessly directly to a smartphone or an iPad, and so it's really expanding out what we can do with hearing aids.
Exciting.
It is, and you know, sometimes hearing aids themselves are not necessarily enough, right? So that's when we start getting into cochlear implants, for example. How does a patient know that that's the right avenue to go down? Well, that goes back to what you mentioned before. At our practice, we really take a very personalized approach, and we say, well, what is the best solution for you? And we do a comprehensive evaluation, and we say, are you going to benefit from hearing aids? As you mentioned, sometimes no matter how good the hearing aid is, it's simply not enough. A lot of times these days, because we have so many options for connecting to devices and accessories, they can really add to what the hearing aid does, and that might be enough. But as you mentioned, that even still might not quite do it for a patient, and they might be more of a candidate for a cochlear implant. And we can definitely do the evaluation for that and kind of talk about those options as well.
And the last time we talked about patience, that it's not just immediate with some of these hearing aids. So talk about that, because people may expect it to be fixed right off the bat, but it does need some time to take effect.
Yeah, no matter what hearing technology you're going to be using, it's going to take some time to not only learn how to use it, but also learn how to more or less interpret the sound, because we're changing the sound. So a hearing aid does sound different than what you're used to. It should be different in a good way, but ultimately you end up hearing more sound around you, and it changes your perception. And after you've gotten used to it, that perception is better than it used to be.
So that's great news.
And I'm sure that part of this is encouraging people to sort of take back a part of their life that they may not even know has been missing, right? What have patients said, maybe 20 seconds or so, that has improved their life?
I hear a lot of times patients come in and they say, I didn't even realize that this particular coffee maker in my home made a beep when it was done.
Oh, that's probably music to your ears.
Yeah, and I say, yeah, you don't know what you don't know. And I hear patients all the time coming in and saying, I can hear my grandkids again.
Yeah.
And that's what this was all about. I didn't realize it was going to have such an impact, and I didn't realize how much I was missing. But now I'm able to follow the conversation without staring at their lips the entire time.
And you get to see an expert who's going to sort of help you redeem that part of your life again. So Doctor, as always, thanks for being here.
Yeah, no
nice
problem.
To see you. Now guys, if you head into any 3 locations during June and mention watching this segment, you can get a free accessory with your hearing aid purchase. If you want more information, check out arizonahearing.com or call 520-600-3277.